Hi, good evening, everyone. I am Dr. Pujan Parikh, consultant pulmonologist at Sir H. Reliance Foundation Hospital. Today is the World Asthma Day, 2nd May, that is first Tuesday of every year. In the month of May, we celebrate as a World Asthma Day. Uh, Global Initiative for Asthma has given Asthma Care for All as a theme for this year's World Asthma Day. The reason behind this theme is that because the majority burden of asthma related morbidity and mortality occurs in low and medium income countries. So, India accounts for approximately 42% of global asthma related deaths, and around 90% of Indians do not receive correct treatment for asthma. Globally, around 235 million people are suffering from asthma, and every year, approximately 4 to 5 lakhs people die because of asthma. Though this number of death is less than 1% out of causes of all death causes, but here we can reverse, means if we can treat the asthma. And basically, most of the death occur when the emergency service in case of acute exacerbation is not available or patient is not on correct treatment of inhaled bronchodilator, inhaled corticosteroid for asthma. So this is sort of a preventable cause of asthma related death. So asthma is basically a common non-communicable disease affecting lungs. It involves both the pediatric as well as the adult age group. As per the Global Initiative for Asthma, they have defined asthma as a chronic inflammation of airways. So, this inflammation of airways leads to symptoms like cough, breathing difficulty, wheezing, chest tightness. This is associated with variable airflow limitation. This symptoms varies on depending on time to time and in intensity. So this is very classical of asthma. Coming to symptoms of asthma, so as I told you, cough, breathing difficulty, wheezing, chest tightness are the four most common symptoms of asthma. Out of this, cough is the most common symptom. Usually it is dry more in the evening and the night time, and sometimes it is associated with mucoid expectoration. Usually, this cough, those patients who complains that their cough is taking a bit long to get relieved, even after starting some basic treatment, then this patient can be suffering from cough variant asthma. Along with the cough, if patient complains of breathing difficulty, wheezing, that is a whistling sound coming from chest, or a chest tightness, then this can be a case of acute exacerbation of asthma. All these symptoms varies in intensity. This is very typical of asthma. This symptoms doesn't stay same throughout the day or throughout the month or a week. Whenever patient is getting exposed to any predisposing or aggravating factor, then only patient gets all these symptoms. So using family history or a history of asthma in childhood is there whenever patient is diagnosed with asthma, even in the adulthood. Now coming to the allergens. So common allergens in India is dust mite, allergic to cockroaches, say pollens, then strong perfume smells, then dampness, mold. All these are the allergen. And there are aggravating factors like a pollution or a secondary bacterial infection, viral infection. All this causes exacerbation of bronchial asthma. So whenever patient complains of all these symptoms along with a typical history of exposure to any aggravating or a predisposing factor, then the diagnosis, most of the time, the diagnosis is asthma. Though we have to rule out other causes of breathlessness, wheezing, chest tightness also, because this can be some related to cardiac causes also. Apart from this, there are other basic symptoms like a runny nose, recurrent rhinitis, nasal congestion. All these are also the symptoms of asthma. Some patient complains of increase in breathlessness, or they get symptoms while they are working. So basically, this is a occupational asthma when they go for work, and if they are getting exposed to a particular chemicals, when they are allergic to that, then they can get a symptoms like asthma. So this is a occupational asthma. There is one more entirety. We call it as the exercise-induced bronchoconstriction. Here, the patient complains of breathing difficulty after 5 to 15 minutes of exercise. Here, the cause is not a exercise. Basically, when patient is getting exposed to an indoor environment, sometimes or some outside also, there are some aggravating factors like in indoor. When patient is exercise in a gymnasium, if the air is cold, then that can aggravate or increase the risk of getting asthma attack. In outdoor activities, whenever patient is getting exposed to dust, and all these are the aggravating factors. So coming to symptoms, as I told you, cough, breathing difficulty, wheezing, chest tightness, nasal symptoms, history of allergy, family history, all these are the typical of asthma symptoms, and it varies from time to time, which is very specific for the asthma. Apart from say coming to the diagnosis of asthma, so whenever you go to a doctor, usually along with the symptoms of cough and breathing difficulty, on physical examination, we find that patient is wheezing, whistling sound coming from the chest. Sometimes we observe that we see that patient is having nasal polyp or atopic dermatitis, which is skin basically. Sometimes patient complains of that they get cough while laughing, or when they get exposed to a particular smell, perfume, they start getting cough, and otherwise they are completely fine. So all this is very typical of asthma. So coming to the diagnosis again, so from the symptoms, physical examination, along with that, there are particular tests which can help us in the diagnosis of asthma, like the pulmonary function test, or can call it as a spirometry. Also, the pulmonary function test is a test to diagnose, basically to find out about the lung capacity of patient. Along with that, we give a inhaled bronchodilator when patient shows a response to that inhaled bronchodilator, along with the basic pulmonary function test showing the obstruction. Then it is labeled as asthma. Obstruction is basically what happens because the windpipe are getting swollen. Patient is not able to exhale completely, and that's why there is some air trapping, air staying inside the lung. So whenever patient is doing any exertion, they have to breathe in and out fast. So at rest, most of the time we have a sufficient time to exhale out. But whenever the patient is doing any exertion, there is not sufficient time for the exhalation of air. So the air gets trapped inside more, and this can lead to chest tightness and the wheezing. So apart from the pulmonary function test, there is something called as impulse oscillometry. This can be useful in the diagnosis of asthma in the pediatric age group, because the pulmonary function test is the effort-based test. If someone is not able to do it, then we can do impulse oscillometry. Apart from this, there is something called as a peak expiratory flow rate. So there is a device, breathometer, which comes and patient can use this at home also. So patient just have to blow in that device. Whenever there is a variability of more than 20% from the baseline, we can label that person as a asthma, because sometimes when patient comes in the acute exacerbation, we can't do a pulmonary function test at that time. On that moment, we have to rely on the clinical symptoms and the chest examination for the diagnosis and the treatment. Apart from this, there is we can do some basic blood investigation like a complete blood cell count. In that, whenever the eosinophils are high, this eosinophils are basically allergic cells. When it is high, we can say that patient is allergic to something, but we can't pinpoint that what is the exact cause of the allergy. Apart from that, there is something called as total serum IgE level. That is also type of immunoglobulin which goes high in case of the allergy. This is also non-specific test. If it goes high, then we can only tell that patient is allergic to something. In response to that, the immunoglobulin E has a level has gone up. To find out exact cause of the elevation in serum IgE level, we can do a skin prick test or a immunoassay, that's a blood test, or to find out different types of allergic, basically against IgE. So skin prick test has a good negative predictive value. So both blood test for different IG level against different allergens, as well as the skin prick test, is both are quite useful in finding out the uh, cause of the means finding out the allergens. So apart from this, there is the radiological investigation which we can do, like a chest X-ray or a CT scan. Sometimes if there is a doubt in the diagnosis, if we want to rule out something else as well. So usually chest X-ray count is normal in case of asthma, unless this patient is suffering from allergic bronchopulmonary aspergillosis, then we can see different patches every time when we do a chest X-ray. The patches in different areas of the lungs. So this is about the diagnosis. Coming to the so apart from this, in the pulmonary function test, also there is something called as a broncho provocation test. So in that case, test basically whenever patient's baseline pulmonary function test is normal, we give a medicine which increases the reactivity of the airways. So if a patient is asthmatic, he will show drop in their lung function. If a patient is not asthmatic, then their lung function remains stable. So this is called as bronchoprovocation test, and we do it by using methaqualone or mannitol. Coming to the treatment of asthma, so the important part in the treatment of asthma is the patient education. Basically, the patient should know what is asthma, what are the symptoms, what are the warning signs, what are the predisposing factor, what are the allergens when particularly after getting exposed to which allergen or which things they are getting this symptoms. Like some patient gets increased breathlessness when or increased cough after they travel for long distance. So here the cause can be a pollution or exposure to dust. So this is very important. Apart from this, patient should know about the treatment plan as well as the emergency asthma treatment plan. Because an acute exacerbation of asthma, if a patient is not patient is far from the healthcare center, he can just take some basic medicine to get some symptomatic relief as well as to control their acute symptoms of asthma. Goal of our treatment is to reduce the risk of reduce the incidence and the risk of recurrence due to recurrence of acute exacerbation of asthma. Along with that, in pediatric age group, our aim is that the patient should get a good lung growth. Their lung growth should not get hampered because of the asthma. In elderly, our aim is whenever patient is getting asthma exacerbation, our aim is to maintain their lung capacity, because every time they get a pneumonia, an elderly person, every pneumonia episode can reduce their lung capacity by 50 to 100 ml. So whenever during asthma exacerbation along with the secondary infection, it overall affects the lung capacity. The third important part in our goal of treatment is to reduce the side effects of the medicine. So usually we start our treatment with an inhaled bronchodilator and a corticosteroid. There is something called as controller medicine, that medicine patient has to take it regularly to control the asthma symptoms. Here, one of the important thing I want to mention is that I have observed that in India there is particularly taboo for the usage of inhaler. So, see, the inhaler is the main treatment for the asthma. Whenever we have to give any medicine for the asthma, if we are giving a inhaled bronchodilator or an inhaled corticosteroid, dose is quite less compared to when we have to give it through orally. So, patient should not fear about the any side effects of the inhaled bronchodilator or a corticosteroid. That's practically side effects are quite less compared to when the same medicine is given orally. So that is one of the taboo. Second thing, patient fear that say when they are traveling group that if someone comes to know that they are having asthma, then the use of inhaler will not look nice. But patients should consider that there is an increase if they get any exacerbation of asthma, then the hospitalization or requirement of emergency care can be more worrisome rather than just fearing about other people. So use of inhaler is most important. Suppose patient with asthma don't use inhaler regularly, and there's something called as a remodeling of airways occurs. Or what is remodeling is basically when I told you about the pulmonary function test that after giving the inhaled bronchodilator and the patient's lung capacity improves. So that is the normal feature we see when patients suffering from asthma is treated. But if the treatment is delayed or patient is not taking inhaled medicine properly, then the remodeling occurs. And even after giving a higher dose of inhaled bronchodilator or corticosteroid, patient will not respond to that because the airways has remodeled. Now it has sort of become fixed. The airways doesn't respond to the medicine once it gets remodeled, because initially when the inflammation is there, the inhaled corticosteroid reduces that inflammation, but gradually, once the patient gets recurrent persistent symptoms and they don't take medicine, then that inflammation can lead to a fibrosis. Basically, the airway gets remodeled and the patient will not get any improvement with medicines. So, coming to apart from the inhaled bronchodilator and the corticosteroid, there are certain tablets, the theophylline group and the antihistaminic group, which helps to reduce the symptoms of asthma. Regular follow-up is very important because once we start with the inhaler, if patient is doing well and the symptoms are very mild, or say in the initial phase, then we can take off the inhaler gradually. So here also the thing, many patients think that the inhaler, once we start, it is a lifelong, but that is not the case. Inhaler is not lifelong always. If we treat it in the initial phase, and the symptoms are controlled, then patient improves. Important part in the treatment of asthma is avoidance of allergens. That is the most important thing, apart from the medicine which we give. Along with that, the important thing is if patient is not getting better with the treatment from the doctor, they need to consult a specialist, chest physician, basically, to for proper guidance of the asthma care. So good control with medicine helps to manage and reduce the risk of exacerbation of asthma. And this patient can lead a normal life. That is the final message from my side. Thank you.